Assalamu alaikum. Good day to all of you, dear doctors. Today I am going to discuss an important topics for MRCS examinations for both MRCS Part A and Part B. The topic name is multiple endocrine neoplasia or MIN syndrome. The another name is familial endocrine adenomatosis or multiple endocrine adenomatosis. Actually, multiple endocrine neoplasia syndromes are rare inherited disorders in which several endocrine glands develop non-cancerous, benign or cancerous, known as malignant tumors, or grow excessively without forming tumors. Multiple endocrine neoplasia syndromes are caused by gene mutations, so they tend to run in families. Now, we'd like to discuss about the types of MIN syndrome. There are several types of multiple endocrine neoplasia syndromes, including MIN type 1, type 2A, MIN type 2B, and another is MIN type 4, which is extremely rare, often caused by hyperparathyroidism. MIN1 is most common, usually inherited from a parent. Most tumors are benign. MIN2A, approximately 95% of people with MIN2 have the MIN2A subtype. MIN2B, a rare form of MIN2. Thyroid cancer occurs in around 90% of people with MIN2B. Now I'm going to share about the signs symptoms of multiple endocrine neoplasia. The symptoms vary depending on which glands are affected. Genetic screening tests can be done to confirm a diagnosis and identify which family members have multiple endocrine neoplasia syndrome. No cure is available, but doctors treat the changes in each gland as they occur with surgery or with medications to control excess hormone production. Multiple endocrine neoplasia syndromes can appear in infants or in people throughout life. These syndromes are usually inherited. The tumors and the abnormally large glands often produce excess hormones. Although tumors or abnormal growth may occur in more than one gland at the same time, changes often take place over time. Multiple endocrine neoplasia syndromes are caused by genetic mutations, which usually inherited from a parent. A single gene responsible for MIN1 has been identified. Abnormalities in a different gene have been identified in people with MIN2A and MIN2B, and a third gene is responsible for MIN4. Types of MIN syndrome. Multiple endocrine neoplasia syndromes occur in four patterns called MIN1, here's find MIN1, MIN2A, MIN2B, and MIN4, although the types occasionally overlap. Now I'm going to share about a brief discussion about MIN type 1. People with multiple endocrine neoplasia type 1 develops tumors or excessive growth and actively of two or more of the following glands. In the diagram you'll see that MIN type A, yes, you'll find the parathyroid glands, parathyroid glands, the small glands located next to the thyroid gland in the base of the neck, the pancreas, the pituitary gland, the adrenal glands, which often affected. Almost all people with multiple endocrine neoplasia type 1 have tumors of the parathyroid glands. Most of the tumors are non-cancerous, but they cause the glands to produce too much parathyroid hormone, which is known as primary hyperparathyroidism. The excess parathyroid hormone usually raises the levels of calcium in the blood, sometimes causing kidney stones. Many people, around 30 to 90% of people with MIN type 1, also develop tumors of the hormone producing cells known as islet cells of the pancreas, also called pancreatic neuroendocrine tumors. More than half of cells tumors produce uh, excessive gastrin, which stimulates the stomach to overproduce acid. People with tumors that produce gastrin generally develop peptic ulcers that often bleed, develop holes, perforate, and leak stomach contents into the abdomen or block the stomach. The high acid level commonly interfere with the activity of enzymes from the pancreas, resulting in diarrhea and fatty smelly stools. It's known as steatorrhea. Some of these tumors produce high level of insulin and consequently very low level of sugar in the blood, which is known as hypoglycemia, especially if the person has not eaten for several hours. The remaining islet cells tumors many may produce other hormones such as vasoactive intestinal polypeptide, which can cause severe diarrhea and lead to dehydration. Some islet cells tumors produce no hormones at all. Some of the islet cell tumors are cancerous and able to spread to metastasize to other areas of the body. In people who have mean type 1 cancerous islet cell tumors tend to grow more slowly than cancerous islet cell tumors that develop in people who do not have this condition. Some people with mean type 1 develop pituitary gland tumors. Some of these tumors produce the you'll see the pituitary tumors produce the hormone prolactin. Some of these tumors produce the hormone prolactin, causing menstrual abnormalities and often breast secretions known as galactorrhea in women who are not nursing, and decreased sexual desire and erectile dysfunction or impotence in case of men. Other tumors produce growth hormone leading to acromegaly. A small percentage of pituitary tumors produce corticotrophin, which overstimulates the adrenal glands, leading them to produce high levels of corticosteroid hormones and causing Cushing syndrome. A few pituitary tumors produce no hormones at all. Some pituitary tumors cause headaches, impaired vision, and decreased pituitary gland function by pressing against nearby parts of the brain. In some people with mean type 1 tumors or excessive growth and activity of the adrenal glands develop, a small percentage of people develop a different type of tumor known as carcinoid tumors. Some people also develop non-cancerous growths just below the skin. Women with type 1 may be at higher risk of breast cancer. Now I'm going to discuss about the mean type 2A. People with multiple endocrine neoplasia type 2A develop tumors or excessive growth and activity in 2 or 3 of the following glands: the thyroid glands, adrenal glands, and the parathyroid glands. Occasionally an easy skin condition called cutaneous lichen amyloidosis occurs in people with mean type 2A. Hirschsprung disease is present in 2 to 5% of people with mean type 2A. Cutaneous lichen amyloidosis found almost everyone with mean type 2A develop medullary thyroid cancer. Here's find the medullary thyroid cancer. About 40 to 50% develop certain tumors of the adrenal glands, which is known as pheochromocytoma, which usually raise blood pressure because of the epinephrine and other substances they produce. The high blood pressure may be intermittent or constant and is often very severe. Some people with mean type 2A have overactive parathyroid glands. High levels of parathyroid hormone cause increased level of calcium in the blood. The increased calcium often causes no symptoms but leads to kidney stones in about 25% of people. Now I'd like to discuss about mean type 2B. Here's the mean type 2B. Multiple endocrine neoplasia type 2B can consist of medullary thyroid cancer. Here's the medullary thyroid cancer, pheochromocytomas, and growth and nerves such as known as mucosal neuromas. Many people with mean type 2B have no family history of it. In these people, the condition is the result of a new gene defect or genetic mutations. The medullary thyroid cancer that occurs in mean type 2B tends to develop at an earliest age and has been found in infants as young as 3 months of age. The medullary thyroid tumors in mean type 2B grow faster and spread more rapidly than those in mean type 2A. Most people with mean type 2B develop neuromas in their mucous membranes. The neuromas appear as glistening bumps around the lips, tongue, and lining of the mouth. Neuromas may also occur in the eyelids and glistening surface of the eyes, including the conjunctiva and cornea. The eyelids and lips may thicken, and the lips may turn inside out, become everted. Digestive tract abnormalities cause constipations. Now I'd like to share about the uh, complications such as digestive tract abnormalities cause constipation and diarrhea. Occasionally, the colon develops large dilated loops. These abnormalities probably result from neuromas growing on the intestinal nerves. This condition happens in mucosal neuroma. People with mean type 2B often develop spinal abnormalities, especially curvature of the spine. They may also have abnormalities of the bones of the skull, feet, and thighs. Most people with mean type 2B have long limbs and loose joints and appear quite thin. Some of these abnormalities are similar to those that occur in Marfan syndromes. You'll find the Marfanite body habitus. Another type is mean type 4 is similar to mean type A or mean type 1, but it's due to an abnormality in a different gene and is much less common. People with mean type 4 develop tumors in their parathyroid glands, pancreas, pituitary glands. In people with mean type 4, usually only one parathyroid gland. Here's the mean type 4. You'll find people with mean type 4 usually only one parathyroid gland is affected. In mean type 1, several parathyroid glands are affected. Also, people with mean type 4 do not have the same skin symptoms as people with mean type 1 do. Diagnosis of mean syndromes are genetic test, hormonal levels in blood and urine, sometimes imaging test are here's the diagnosis I'd like to share. uh, Tests are available to identify the genetic abnormality present in each of the multiple endocrine neoplasia syndromes. Doctors usually do the genetic tests in people who have one of the tumors typical of multiple endocrine neoplasia, and in family members of people already diagnosed with one of the syndromes. Screening of family members, sometimes even before birth, is particularly important because about half of the children of people with a multiple endocrine neoplasia syndrome inherit the disease. In rare cases, a person with multiple endocrine neoplasia may have normal genetic test results. Blood and urine tests are done to detect elevated hormone levels. Imaging tests such as ultrasonography, computed tomography or CT scan, MRI, magnetic resonance imaging, and positron emission tomography or PET are also needed to help doctors determine locations of the tumor. Treatment of Wynn syndromes are actually the tumor removal, often removal of the thyroid gland. Medications, no overall cure is known for any of the multiple endocrine neoplasia syndromes. Doctors treat the changes in each gland individually. A tumor is treated by removing it surgically when possible. Some small pancreatic islet cells tumors are not removed immediately but are monitored to see whether they are increasing and treated if they become large enough to cause problems before removal, or if removal is not possible, doctors give medications to correct the hormone imbalance caused by gland overactivity, and excessively large and overactive glands without a tumor is treated with medications to counteract the effects of the overactivity, because medullary thyroid cancer is ultimately fatal. Medullary thyroid cancer, which is has medullary thyroid cancer, are ultimately fatal if untreated. Doctors will most likely recommend preventive surgical removal of the thyroid gland if genetic testing has revealed evidence of multiple endocrine neoplasia type 2A or type 2B. This preventing surgery is done even if the diagnosis of medullary thyroid cancer has not been made before the surgery. Unlike other types of thyroid cancer, this aggressive type of thyroid cancer cannot be treated with radioactive iodine. Once the thyroid is removed, people must take thyroid hormone for the rest of their lives. If thyroid cancer has spread, other treatments such as chemotherapy or other drugs can sometimes help the person live longer. Few chromocytomas must be removed. Few chromocytomas must be removed surgically. You will find that few chromocytomas must be removed surgically after the person's blood pressure has been controlled with appropriate drugs, because tumors may not all develop at the same time. People with multiple endocrine neoplasia may become anxious and worried about when or whether another tumor will develop. Periodic monitoring with blood and imaging studies is important but may add to the anxiety. Counseling may be needed to help people better understand their disease and cope with this anxiety. Uh, Now I'm going to share some slides about multiple endocrine neoplasia. I think this brief discussion is enough for all of you about multiple endocrine neoplasia. Here you'll find the types of Mean syndrome, and some symptoms are also given briefly. Yes, I have made a brief diagnosis about Mean syndrome, and lastly, I have described about the types with mnemonics such mean 1, mean 2, mean 2b. Here's mean type 1 is 3p and type 2b 2p and phoneme, and find it will, I think now I've got an brief discussion or a brief idea about multiple endocrine neoplasia syndrome. If you have any other questions, feel free to ask me. Okay, thank you all of you, dear doctors.